Hey friends, welcome to my holistic health channel, Living Well with Dr. Michele on locals.com. And today we want to talk about, is your pain or health problem a mind-body problem? So let's take a look. But first, why should you listen to me? Well, I'm an acupuncture medicine doctor. I've been practicing for over 22 years, and pain is usually what brings people in to my practice to seek acupuncture care. But it's usually also, there's many other health complaints that go along with just, pain, like back pain, neck pain, headaches, migraines, you name it. There's also a lot of stress, anxiety, depression, and insomnia. And how do we know if these chronic problems are psychosomatic? And psychosomatic means mind-body. Psycho is the mind and somatic is the body. But we don't like psychosomatic. It sounds, it sounds psycho. So how do we know that our problems stem from our mind? Because we are what we think, right? So, signs that your illness, your pain, anxiety is from your mind. And I like to say inner repressed rage, because repressed emotions become rage. And we are unaware of them. They're subconscious, but they're there. And here are some indications. Pain, maybe all the time. Usually your sleep is affected. And number 3, there's really no known reason. There was either no distinct onset or mechanism, or the injury has healed. And it has been years ago. It could have been 5 years ago, 20 years ago. And the brain, for some reason, just keeps believing that there is a problem, say in your shoulder, your hip, or your back. So there may have been a history of trauma, an accident, or there might be work issues or financial strain, relationship issues, child rearing problems, grief, loss of a loved one, or deep-seated childhood issues that could have been neglect or physical abuse, mental, emotional abuse, that even could be disapproval, like that need of always wanting approval and never feeling that you are enough. Really, everything, no matter how you slice it, comes down to the feeling of I'm not good enough. Post-traumatic stress syndrome. So pain is often described as everywhere. It never gets better. There can be multiple symptoms like pain in different places. I have neck pain, migraines, ankle pain, hand pain, along with irritable bowel. You get my idea here. Nothing makes it better. The pain is the same. Even if you're having treatments and you can do things longer, your activity for, let's say, walking or going up and down stairs improves, your range of motion, like now you can reach up and actually grab something. But when asked, you will say, it is not any better. No, the pain is the same. For some reason, you still have the sense of pain. And if there's temporary relief, it often returns, or it returns to a different place, or you come up with a different problem. So there is often a psycho-emotional characteristic to your pain. And I ask the question sometimes, is there a fear of healing? What will you do if you no longer have the pain? So it must be serving you in some way. That pain is serving you to either complain or avoid something. Maybe you get out of doing something you don't want to do. Maybe you don't want to work, or maybe you don't like to work, or maybe you want to stay in bed and just put the covers over your head because maybe you're pushing yourself so much. You're always doing to be the best, to be the most successful. But that migraine comes on because it's telling your body, hey, take time out, right? You may even have redness, swelling, tenderness, and it's usually, it can be bilateral. Because the sympathetic nervous system is elevated. And when I say sympathetic nervous system, I'm talking about that fight or flight. It is our stress system, and it cannot function all the time. You just over time, everything starts to break down, and the parasympathetic cannot function, right? So the parasympathetic is your rest and digest. So you need to be either in fight or flight or rest and digest. And you cannot be nervous and relaxed at the same time. And I ask, also, has your pain worsened after hearing results of imaging? Like your x-rays, MRI. And were you actually going in the right direction? Like, were you improving? And then you finally either got the appointment to see your doctor, or maybe you finally received the test results and they go over them. And now that picture in your mind is so strong. And now you have that deep belief because you've seen structural changes that there's nothing you can do. So now you have a total loss of empowerment. Now it's bone on bone. I hear that all the time. Well, it's bone on bone. There's nothing I can do. And so the improvement that you were feeling is now down the toilet. It's gone. And now you can't walk. Okay, you're resolved to either just live with it or have that invasive surgery that you wanted to avoid, but now there's nothing you can do, right? And there is also a hypersensitivity to pain, and you may even not realize there is a hypersensitivity. You may even feel that you're still that tough person that you were 10 years ago, 5 years ago, 20 years ago, whatever. You may describe yourself as, hey, I'm not a complainer. I have a very strong pain threshold, but you have fibromyalgia. You cannot say, I have migraines, I have fibromyalgia, I have irritable bowel, I have anxiety, I have insomnia, I have depression, I have arthritis. You really cannot say that you have any of those things and say you don't have a hypersensitivity to pain. And it's okay. I mean, it's just that for some reason you're wanting to be tough and you see it as a bad thing. And there's nothing wrong with you if you have pain. Don't judge yourself. And this happens to everyone at some point or another in their life. We use pain to hide behind these emotions that are even worse, right? So because we can't always walk around like a screaming idiot and be belligerent and be super angry, and we don't want to feel these things. We hide behind it, and the fear, in some way, as I explained, is serving a purpose, or maybe it did serve a purpose initially and it no longer serves us, and it's time to maybe drop that. So what are signs that your problem is not a mind-body problem? So we must talk about that, because we have to exclude birth defects, acute physical traumas, or anything that's a life or limb threatening emergency, vaccinations, a lack of water, lack of food or nutrients, any drug reactions, surgeries, or other iatrogenic causes. Those are not mind-body. So you just need to recognize that pain is a reaction to a psychological state. And there is a tendency to have physical reactions, and it's universal. It's a normal component of everyday life. And it's just something that happens. And Psychosomatic, mind body pain means you have real pain, and there can be real changes in the tissues. There's real degeneration that happens, but it began in the mental, emotional, spiritual levels. And that root causative factor is repressed rage in the mental, emotional, spiritual levels. So we are what we think, right? As a man thinketh in his heart, so he is. Let me read from As a Man Thinketh by James Allen. Mind is the master power that molds and makes, and man is mind, and evermore he takes. The tool of thought in shaping what he wills brings forth 1,000 joys, 1,000 ills. He thinks in secret, and it comes to pass. Environment is but his looking glass. So, we are what we think. We become what we think. And we have these energy centers, psychoneuroendocrine centers. We can call them chakras, and also our acupuncture organ meridian systems that directly relate to our thoughts, because the thoughts first, emotions and feelings, and then you have that trigger of hormones, neurotransmitters, signals to the brain, and then the brain sends signals out to the body. And when the brain sends signals to the body, there is a reduction of oxygen to, let's say, a tense area like your back, your shoulder. It becomes tense. There is a reduction of circulation. So there is less blood and oxygen and nutrients getting to a specific area, or your knee or your elbow. And over time, there can be actual physical changes, but first is the pain. So tapping into your chakra, acupuncture organ meridian systems can be a tool to help you balance your body, mind, spirit, and your soul, and to deal with these psychosomatic mind-body problems. You can find out more at my Living Well with Dr. Michele channel. For my next lesson, join me here. Living Well with Dr. Michele. I spell my Michele with one L, M-I-C-H-E-L-E. So it's Living Well with drmichele.locals.com/support. You will find more podcasts and interesting videos and classes. I hope to see you there. And we must give a quick disclaimer. These products, methods have not been evaluated by the FDA. The products and methods recommended are not intended to treat, diagnose, cure, or prevent illness or disease. Please consult with a licensed health professional to address any specific health concerns that you may have. So join the community, listen, watch, learn now. Go to livingwellwithdrmichele.locals.com/support. I appreciate you. Thank you. Have a great day. Namaste.